All righty. Good morning, Pagosa. It's Friday, and a very good morning, everyone. Good morning, Pagosa, today over at the Pagosa Springs Medical Center with Dr. Bill Webb and Dr. Jeremiah Steed of Orthopedics. So we're going to talk about that. And good morning, you guys.
Good morning.
Thanks for inviting me to the hospital.
Yeah, well, thanks for coming. Sure made it easy on us. So.
You bet. This is great. So, Dr. Bill, you've been on the radio quite a few times.
I have. And usually I have my lovely bride with me today. Most days anyway, not today. But yes, I have, and it's been great fun.
Yeah.
So, I'll just kind of start with my part, if that is okay.
That'd be great. Yeah.
So, as anybody that's listened to this story before, Rhonda and I moved out here full-time almost 11 years ago, she kicking and screaming. But we've really had a great experience out here. I started the orthopedic program out here. There was a couple of guys from Durango that would come over and see clinic, but would never do any sort of cases or anything over there. So it was a great opportunity, and it has been super. I am just tickled to have Dr. Steed join me. And, this was just one of those happenstance things that happens in Pagosa all the time. I mean, most people are here because they were driving through and they looked at the place and said, oh, what a gorgeous place. I think I want to live here.
Right.
And most of our providers are that way. Dr. Steed's different because he was raised here, so he already knows how beautiful it is. And he sent us an email and just said, is there a possibility that y'all would have a place for me to practice? And we jumped on that big time. What a great thing
Good
to have
story.
somebody from here.
Oh, yeah.
And so he is extremely well trained, as he will tell you, and he has talents that I don't have. So it's going to be, really a good person to practice with. And
someone out in the lobby said you both have good hands.
Yes, yes,
that's important, right?
Good hands and nice people.
And
that's
nice
people.
Also
good.
That's right, exactly.
Can't say that about all surgeons, but yeah. So anyway, I'm going to let him take up most of the time because he's the new guy in town. We need to know about him.
Right on. Dr. Steed, it's all yours.
I appreciate it, Will. Thank you so much for having us on and giving me the opportunity just to share a little bit, about where I've come from and what I've been through. As Dr. Webb said, it was kind of happenstance that I looked into seeing what kind of opportunities there were here, and I'm just so pleased and so excited that it's worked out for me to get to come and work at the medical center here. As has already been mentioned, I was raised in this area. I was born in Durango, Colorado, about an hour away, as everyone here knows, because it's can't get born here in Pagosa unless you're getting born at the house. That's right.
In the car or something.
My folks lived in Allison at the time, and so, but by the time I was, before I was even one, they moved to Pagosa Springs. So it's really all I've known, and I absolutely loved growing up here. The mountains are incredible, and the opportunity to get out and to do the things that we get to do in the outdoors all year around is really amazing. And then the folks in the community here is just something that I grew up really loving. And, I feel like a lot of people who grow up in a small town, maybe in their teenage years, they're just dying to get away and they feel like the world's out there and they're missing out. But, I really didn't ever feel that way. I always loved Pagosa Springs. I loved the community here, and I loved the mountains. And, whenever I moved away...
you probably went away to school, right?
Yeah, I had to go. Whenever I decided that maybe medicine would be a good thing to do, I had to obviously move away for training. And it's really only then that I actually began to understand just exactly how special Pagosa Springs is. Mm-hmm. And I've missed it a lot since I've been gone. But in 2010, I went to El Paso and I did my undergrad there and majored in physics. I'd been going there actually throughout my life because I've had aunt and uncle and cousins that lived there. So that was kind of familiar in some way, but it's quite the culture shock, honestly. Actually, whenever I moved there, the climate is quite different and the culture is different there. But by the time I left, I had actually grown to enjoy it and was able to get my undergrad there. And then I went to Lubbock, Texas for medical school at Texas Tech University at the Science Center. And I really enjoyed my time at Lubbock. Really great people there, and it's a good place to study and to train. For those of you who haven't maybe been to Lubbock, there's not maybe a lot to do. Isn't it? Maybe not a lot to do except study. So
garden spot.
That's right. But it was. I think it's a great place to go to medical school because, again, it's pretty cheap. Cheap living, no traffic, and you get to study because there's not maybe a whole lot else to do.
And how far is that from here? I mean, you could drive here pretty quickly within half a day.
Yeah, 7.5 hours.
Yeah.
7.5 hours away probably. And so, my folks lived here during that time, so we'd come and we'd visit, and it was a convenient place to go to medical school. I was interested in orthopedic surgery even before I started medical school. And I tried to have an open mind, but during my rotations in med school, it became pretty evident pretty quickly that is what I wanted to do. Mm-hmm. So I was able to get into orthopedic surgery residency at Baylor Scott and White, just north of Austin in Temple, Texas. Mm-hmm. And so that's where I did my residency training, and really, really loved the program there. I feel like I got really great experience, and they were really good at getting us in the OR and teaching us how to operate. And so I'm really grateful for that experience. I look back fondly on that decision to go there. And then I went to fellowship at Tacoma, Washington, just south of Seattle. There's a fellowship there, adult joint reconstruction fellowship. So that pretty much means hip and knee reconstruction for the most part, doing hip and knee replacements as well as revisions. And that was a really great year to spend up there getting additional training with joint replacements.
Beautiful place, too.
Yeah, it's a very nice place.
Right near the airport, SeaTac.
Yeah, that's right. Yep, SeaTac's kind of stationed right there between Seattle and Tacoma. So my wife actually went to college there and grew up in that region, so it was good for her to get back. And it was a great time for the family and great time for me professionally to get to develop even more skills in arthroplasty. And one of the things that I was able to learn there, and actually one of the reasons I went there, is because they do a lot of anterior approaches to the hip. And so that's something that I'm really excited to be able to offer here, is doing an anterior muscle sparing approach to the hip, which I think offers a lot of benefits. And I'm excited to be able to do that for total hip replacement. And then I also was able to do a lot of revision arthroplasty. So unfortunately, hip and knee replacements don't always behave the way we want them to for as long as we want them to. And problems happen, and they have to be revised. And so that can be a challenging endeavor. And so having expertise in revising hip and knee replacements is something that I was after at that year.
So did you do much as far as fractures around joint replacements?
I didn't actually do that many. I did a few. I actually did some fractures that didn't have anything to do with joint replacements. But, I did actually probably quite a bit of, I would say, more paraprosthetic fractures in residency.
Okay.
So, I definitely have
just because they got sent there.
Yeah, it's a big trauma center. And so, they just would be sent there. And so, I did a lot. We did a lot of revisions, and I did a lot of taking out stems and putting another one in and using cables to button it all up.
Super.
Yeah, so paraprosthetic fractures.
Be used.
Paraprosthetic fractures are definitely something that is in my realm of expertise. So, anyways, that's kind of a sum up of what I've been doing the last 14 years since I left Pagosa. Before that, I built houses with my dad here, and so that's probably maybe why I was kind of wanting to do orthopedics whenever I got into medicine.
Right, the hands. There you go.
That's right.
Now, you also do shoulder replacements.
I do. Yeah, shoulder replacements is something that I actually became very comfortable with in residency because I did so many of them. Specifically, reverse shoulder replacements is something that I just did a whole lot of. And so, I feel very comfortable doing shoulder replacements, and it's something that we offer here.
You want to tell them the difference in a regular replacement and a reverse?
Yeah, so a reverse, it's actually kind of crazy that you can do this, and it works so well. A reverse shoulder replacement is where you kind of take the anatomy of the hip that God gave us, and you the shoulder, and you kind of flip it around. So the humerus is a ball, and it articulates, or it goes up against our scapula, which is more of a flat surface. And so, I do total shoulder arthroplasty as well, what we would call anatomic, where you actually replace the ball of the humerus and you replace the shoulder blade that it goes up against, just the surface of it. But for a lot of folks, if depending on the quality of the muscles and the tendons around their shoulder, that might not be a great option. They might not have great mobility. If they have a lot of rotator cuff pathology, or if their shoulder blade is shaped really strangely, the surface where the humerus articulates, then doing what's called a reverse shoulder arthroplasty is actually something that has been very successful and is increasing in popularity. And what you actually do is you put the ball on the shoulder blade, and you actually have more of a flat cup surface that you put on the humerus, and it articulates in that way. And it's really, really a successful surgery whenever you do it for the right reasons, and it can restore function and decrease pain in a dramatic way because it kind of changes the way the biomechanics of the shoulder works.
And who
That's
thought
amazing.
of that, Wow.
It's unbelievable, really.
Yeah.
Somebody by the name of Gramont or something.
Yeah.
Quite a long time ago.
Yeah.
A reverse
If you were just to float
shoulder
that idea to
replacement.
me, I'd be like, you're a little crazy. But
It works.
it's been done hundreds and thousands of times, probably millions of times across this country over the last couple decades. So it's something that is a good option for some folks.
Yeah, what would be the diagnosis? Like, what would lead to that option?
Yeah, so honestly, if you were to open up a textbook, the number one reason you would do that is what's called rotator cuff arthropathy.
Okay.
So your rotator cuff has torn, and it's no longer holding that humerus in the right position. And so over time, that humerus moves up and it starts to rub on that glenoid. It rubs all the cartilage away, and your rotator cuff tendons just are not functional and are not repairable. And you have severe arthritis. That is the
Sounds painful.
Absolute indication for it, yeah. But it's been so successful that even for folks who are wanting a quicker recovery and have really large rotator cuff tears, maybe with the tendons in not so good condition and probably wouldn't heal so well with a rotator cuff repair, it can be a good option for folks like that as well.
Dr. Jeremiah Steed on KWUF and Dr. Bill Webb. We're talking about orthopedics, and it's fascinating. It's amazing what can be done.
And it changes rapidly, let me tell you.
Is this like do you have to stay at the hospital at all for these kinds of procedures that we're talking about, the reverse deal?
Yeah.
Do you have to? Is that a?
It depends. A lot of times, folks who get these shoulder replacements can go home the same day.
Yeah,
but it just depends on the patient
Sure.
and kind of how things go. Sometimes an overnight stay is appropriate.
It just seems like that.
Yeah.
Used to be, a week or 5 days.
Yeah,
Now you can just
as Dr.
walk
Webb
out,
says,
basically.
Things are just changing so quickly, and that is something that's changing as well. We're getting anesthesia services are getting better at doing good blocks, and orthopedic surgeons are continuing to develop techniques where things are a little bit more minimally invasive, and
more precise with with
sometimes
technology.
navigation. So sometimes we're getting to where folks can go home quicker and safer.
Obviously, I've been at this game a long time, but I remember people having a carpal tunnel release, which is just a very simple little surgery on the hand, staying in the hospital for 3 days.
Oh, really?
Yeah.
Wow.
Yeah. I mean, it was crazy. You could just check in the hospital if you needed some rest, and they would, put a note on the door that says "Do not disturb," and they come give them food every once in a while. Yeah,
Wow.
and
Right.
those days are long gone.
Impressive. That's fantastic. So, any other updates for the orthopedics department?
So there's a couple things coming up. On October the 15th, there is going to be a presentation at the Liberty Theater, starting at 6 and going to 8, and mainly starring Dr. Steed over here. And he's going to just talk more in detail about these procedures, and there will be opportunities to be able to ask questions. Apparently, there's going to be free popcorn. How
This
can
is
you pass
something
that
new
up,
at the Liberty
right?
Theater. They do a lot of things over there.
Well,
now.
they really
That's pretty
have
cool. That's a cool idea.
starting to get some educational stuff there too.
Very cool.
They're trying to have more things going on besides Beetlejuice,
Beetlejuice.
which is apparently very good.
Yeah.
I've heard. Yeah,
So Tuesday, October 15th,
Right.
6 to 8.
right. And then the other thing we've got going on, people probably have noticed, is the building on the corner by the hospital that used to be Dr. Pruitt's building, and the hospital bought it a year and a half or so ago, and it's being remodeled, and it's going to become a wellness center. But one of the things that I'm most excited about is we're going to expand physical therapy. Nice. And this town has never had enough physical therapists. They have wonderful physical therapists, but not enough, and it's really hard to get somebody in a timely fashion to see. And so we will be able to, have more therapists available. There's also going to be a big meeting room in there for the, community to use too. And there's some other things that may go in there, but that's kind of where we're starting.
It looks big.
It is, and it's going to be nice when it's done.
Yeah.
From what I've seen of it so far.
So that's the latest from Pagosa Springs Medical Center, orthopedics. And Dr. Webb, Dr. Steed, why don't we take a quick break? We'll come back and kind of wrap it up. How's that?
Sounds great.
Okay. All righty, we're back. Good morning, Pagosa continues live at the Pagosa Springs Medical Center. It's Friday, the 27th of September. And once again, we're just here talking with Dr. Bill Webb and Dr. Jeremiah Steed, orthopedic surgeons here at the medical center. And, we've said it so many times how proud we are of this hospital and how it's grown over the years. I mean, it's just been amazing, and it continues. Anything else you want to say about your orthopedic department or what's going on here?
May it continue to grow.
Right. Right.
No, it's been a great place to practice and lots of fun, and the community has been very supportive. And I think it's going to just get that much better adding Dr. Steed here. And so.
Yeah. So when you were younger, there was hardly anything here, right? Maybe a clinic.
Yeah. No, that's 100% right. When I sent that,
do you remember that?
Here just a couple years ago, I didn't really know what to expect. I knew that Dr. Webb had started and was doing orthopedic surgery here, so that's what prompted me to even send the email. But whenever I left for college back in 2010, this was, there was just a clinic.
Yeah.
There wasn't even a hospital here. So to see how much it has changed in the time since I've been gone has been pretty amazing. I'm just thrilled to have the opportunity to come and to be a part of what's going on here, and excited to serve the community here, hoping to be a blessing to the people here and to the medical center.
So the one thing I want to make perfectly clear is I am not retiring yet. I know the rumor mill is full of, okay, Dr. Steed's
That's what
here,
Dr. Bill Jordan said, too.
So you can go home now.
No, you're not.
I'm not ready. I still enjoy what I'm doing. I still think I do a good job, and so I'm not leaving yet.
Yeah, that's kind of what I heard. So that's good. That's good to know.
I'm happy to hear that. That's,
looks like a great team you guys have. So that's awesome.
I'm excited. It's going to be great to have someone who's been here, been practicing to bounce ideas off of and ask about how they've been navigating certain situations. I'm blessed to have that resource.
Like our computers.
100% like our computers. Can you believe I'm having to ask them about how computers work?
That's great.
Getting up to speed with the new electronic medical record is a little bit daunting.
It's a little painful.
Yeah,
painful is a good word. I was going to be a little kinder, but
computers can be. They can be
indeed.
But one of those things you just can't live without either. So
not apparently, not these days.
But thank you guys so much. Really appreciate your time here, and thanks for inviting me over to the hospital. And wish you guys a great fall and beyond.
Yeah.
Well, thank you. Great talking to you again.
Thank you so much for having us on, Will.
Come back and get back on the radio sometime.
No, that sounds good.
All right. Thank you. So long.